Alright, my name is Dr. Rashaad Nauth-Ali. I'm the chiropractor here at BodyMend Wellness, and today we're doing a workshop on shoveling snow safely. So today we'll be going over the dangers of shoveling, high-risk populations, so people that should be very careful when they're doing their shoveling, proper preparation before you shovel, and the proper techniques when shoveling, as well as some samples of ergonomic shovels, so shovels that are safer to use. So the dangers of shoveling. So shoveling is the most common cause of back injuries during the winter. This is because the cold temperatures and physical insertion increase work on body and the heart. So most people have to shovel first thing in the morning, and that's when your body is most tense because you've been sleeping all night, so the muscles tighten up and you have higher risk of injuring your back when shoveling first thing in the morning. Also, Valsalva maneuver while shoveling can drastically increase your blood pressure. So what the Valsalva maneuver is holding your breath when you exert any force. So if you're lifting weights, instead of breathing, you hold your breath, and same thing with shoveling. So if you hold your breath when shoveling, it increases your blood pressure, and that can cause heart problems. And improper footwear also leads to slip and fall injuries. So it's very important to make sure you're using the proper footwear when shoveling. So who is at risk? So people with existing health problems and injuries are obviously at risk to re-injure themselves. So this could be anything: knee problems, back problems, shoulder problems. Older adults, usually older adults have some health problems already. And then people who are at risk of heart attacks include anyone who's already had a heart attack. So you're always susceptible to another heart attack after the first one. People with a family history of heart disease, so if your mom or your dad had heart issues, you're also at risk to have heart issues, right? If you already have high blood pressure or high cholesterol, and smokers. So don't smoke. It's not good. And then sedentary individuals. So individuals that don't do much activity during the year, they're at a high risk because they're not used to being active and lifting weights and shoveling and stuff like that. So shoveling is a very it's a hard activity to do, so if you're not used to activities, you have a higher risk of hurting yourself. So you know the signs and symptoms of a heart attack? Anybody? Can I have a sign or symptom?
Numbness.
Where?
Down the arm.
Okay.
Clammy.
Yeah, it's clammy sensation.
Chest pain.
Very good. The most obvious.
Sweating.
Sweating, yes, like I am right now. Sorry?
Breathlessness.
Yes, and shortness of breath. So chest discomfort or chest pain, discomfort in other areas of the body. So with the chest pain, you can also get arm pain, you can get jaw pain, you can get ear pain. Shortness of breath, sweating, nausea, lightheadedness, or unusual tiredness. Also with increase of blood pressure, as we talked about from shoveling, you could also be at risk for a stroke. So do we know what FAST stands for? FAST is an acronym for the symptoms of a stroke. Do you know? Have you ever heard about this before?
Yes, we have heard.
Okay. So F in FAST stands for face drooping. So as you can see, there's drooping of the face. So if you think somebody's having a stroke, you can ask them to smile. And if they can't smile evenly, one side's dropping, you know that's one of the signs. Arm weakness. So we also get them to raise their arms up. If one arm can't raise up, that's another sign to look out for. And speech difficulty, so they won't be able to talk properly. So they'll be they think they're speaking properly, but they're just mumbling and nothing makes sense. And then T is time to call 911. So with stroke victims, there's a small window of opportunity to get them to the hospital to reduce the amount of damage to the brain that happens. So they have about an hour to 2 hours to administer clot busters to break up the clot that causes the stroke, and they have a better chance of full recovery at that point. So preparing to shovel. So proper preparation is very important when shoveling to reduce the risk of injury. So one thing to do is avoid caffeine or nicotine. These are both stimulants that get the heart racing too much already, so any more stress to the heart can lead to other heart issues, such as heart attacks. Avoid eating large meals. So when you eat a large meal, all the blood and energy has to go into digesting your food, and you need the blood and energy into the muscles. So if the blood isn't in your muscles, they're not going to be strong enough and be able to do the work that they need to do to shovel the driveway. So light meals are better. Like you wouldn't eat a large meal before you go swimming, right? So it's the same idea. Drink plenty of water. Even though it's cold outside, you still want to stay hydrated. It's very important because, again, you can increase the risks of injury and heart issues. And then dress in several layers. It's important to stay warm. You can always take a layer off, 2 layers off, but you want to make sure you're warm. And then wear proper footwear again, because you don't want to slip and fall. Proper footwear would be boots with big treads in it, very thick rubber soles, and that will reduce your risk of slipping. So warming up. So some simple warm-ups we'll go over. So as I said before, your back's especially vulnerable in the morning because you've been tired and sleeping all night, so the muscles aren't ready to do their work. So we want to do a nice 5 to 10 minute warm-up before shoveling, especially first thing in the morning. So something we can do is go for a small walk or do some exercise that we're going to do in a second, and with gentle stretches as well. So some stretches that are very good to do to warm up the entire body would be knee to chest. Can I get somebody to help demonstrate, Nicole?
So just like the picture, you just want to grab your knee, bring it to your chest, and the balance is probably an issue as well, so it's better to have something to hold on to when you're doing that.
And then for the shoulders,
so just arm across your body and just pull it towards your chest.
and triceps,
And that's just bringing your arm up and pulling your arm right behind.
and then for the back and hamstrings.
Obviously, not everyone's that flexible, so just do what you can, right? Nice and easy, you don't want to be going quickly. Slowly lower yourself. And just let yourself hang there. And usually about 20 to 30 seconds is good to hold.
Perfect, thank you. So proper technique for shoveling. To avoid injury, you want to make sure you're doing it properly, correct? So you want to keep your feet wide apart, so this will increase the amount of stability you have. If you are too close together, you risk the chance of slipping and falling. When you're wider apart, you're more stable. Just like in sports, you want to be stable. You want to put the weight on your front foot and push the shovel. So you want to have your weight on your front foot and push the shovel with your body weight. Okay? And then shift your weight to the rear foot and keep close to the body. So you're going to be pushing and then coming back and then pushing and coming back, right? And then turn your feet in the direction of the throw. So you never want to pick up a load and then throw it away from your body. You want to pick it up, turn to where you want to throw it, and then throw it. Okay? The reason why you don't want to pick up a load and just twist and throw it is because it's very bad for the discs in your spine. So when you lift, the discs are under a lot of pressure, and you don't want to twist with that pressure on the spine because it can injure the discs. Okay? We don't want that to happen. And some tips on snow removal. So clear the snow early and often, so it's always easier to shovel snow that's just fallen versus snow that's fallen all night. So it's better to do it 2 or 3 times at night than do it first thing in the morning when it's much higher and harder to lift. You want to pace yourself, so take your time. You don't have to do it all in one shot. You can do some, go back inside, come back out, do some, and take a few trips. Watch your footing, again, slip and falls with the ice, and then push the snow rather than lift. So it's easier to push snow off the driveway than it is to shovel and lift and throw, and it is safer for you as well. And always use your legs, so that's why you want to push with your legs, right? You don't want to just pick up the snow and throw it all the time. And then again, avoid the awkward throwing postures like twisting and throwing to help with the back. So ergonomic shovels. Shovels with a bend in the shaft are always easier to use, and they're easier on your lower back. So this is an ergonomic shovel. This is not. Okay? So you see the difference in the shafts? This one's straight, and this one is bent. Okay? Choose a shovel with a D-shaped handle. So the D-shaped handle, almost all shovels have this now, and they're just easier to grip. You see how it's shaped like a D? right? I think this is 20 years old and still has a D-shaped handle. Almost all shovels are going to this handle because it's a better grip. And a smaller shovel, 10 to 14 inches, is always better to use when throwing the snow, for lifting and throwing. So this would be an example of a shovel to throw with, okay? So this bigger one would be pushing, when you have to push the snow. And then if you do have to pick up smaller amounts, this is the one to use and throw, because it's a smaller load and it's closer to the center versus this one, right? So it's a wider surface area. So this will be lighter and easier for you to throw if necessary. So shovels with the metal edge might be useful sometimes, but they could also be very dangerous. So this one has a metal edge in it as well. And this is because they get caught in the cracks in the sidewalk maybe. They can catch any unevenness on the driveway, and you can hurt yourself. So I don't know if you've probably done this before. You're shoveling, and then and it hits you in the stomach because it gets stuck on something. That's usually because the metal will get caught in something, right? Because it's a little bit sharper. So you just got to be very careful with that. Avoid using those if necessary. So say you're shoveling, you got hurt. What do you do now? So first you have to assess the injury for yourself. Is it very bad? Do you have to go to the hospital? If say you slip and fall and you can't walk, that's the time you should probably go to the hospital versus waiting till the next day to go to see your doctor, okay? So if you feel really bad, it's hurting a lot, go to the hospital. Call 911 if you have to, or make a trip to the emergency room. You have to know whether to use heat or whether to use ice. I get this question all the time. When do I use heat? When do I use ice? So ice is usually if you fall and you hit something and you get a bruise, you want to use ice to help with the pain and the inflammation. If you just sore after the injury and it's more muscle and tightness, you'd want to use heat, okay, to keep the blood circulating and keep things warm. So when you're using ice, what we like to refer to is called the RICE method. So R-I-C-E, RICE. It stands for rest, elevation, rest, ice, compression, and elevation. So what you would do, say you hurt your knee, you would put ice on the knee, okay? You would lay down and put your leg up on a pillow or something like that, and then you would wrap a bandage around it to keep everything compressed and tight. So you get the rest by relaxing, the ice on the knee, the compression with a tensor bandage, and then elevation by keeping your leg up in the air, okay? And then you would want to call and schedule your appointment or your assessment with your chiropractor, your physiotherapist, or your family doctor, whoever you think you need to see. And then follow through with your plan of care. So when you do see somebody, say you came in and you see me, we'll develop a treatment plan for you. And what's very important that you follow through with the treatment plan, because you may not feel like you have a lot of pain, but there's still an injury that's going on, and it needs to be healed 100%, or else you risk injury down the road again too. So it's very important to listen to your healthcare practitioner and follow through with your plan of care. So what can I do for you, Dr. Rashaad? First of all, I would do an assessment with you. So we'd find out exactly what happened, what the injury is, okay? And then we come up with your diagnosis. So if it's your low back, what is it? Is it a disc herniation? Is it just a sprain or strain? We'll do some exams and assessment, and we'll get you the right diagnosis. And then we'll create a treatment plan, as I said. So the treatment plan will consist of what types of treatment you're going to get and with who you're going to get it with. It doesn't necessarily have to always be with me. It could also be with physiotherapy and massage therapy as well. And then we can refer you out if necessary. So I'm not able to treat everything. I like to think so sometimes, but sometimes we need other people. So like your family doctor, surgery is sometimes an option with some of the injuries that we see. So we'll refer you out to the right people if necessary. So what is chiropractic care? Have you ever seen a chiropractor? No? So this will be very good for you to hear. So what is chiropractic care? So it's a non-invasive, hands-on healthcare discipline dealing with the nerves, the muscles, and the skeleton and the joints. So we don't use any medication, it's all with our hands. So we'd like to do soft tissue manipulation, which is like a massage, okay? But we do it very specifically on certain muscles that are affected. I also do electroacupuncture, So you've heard of acupuncture, right? So with the electroacupuncture, we put the needles in the specific muscles that we need to, but then we use electricity to stimulate the nerves to help calm everything down and regulate the nervous system to help with pain and dysfunction. And then we also do the joint manipulation, also known as adjustments. So you might have heard it referred to as getting your back or neck cracked. We call them adjustments. And what it is that we increase the range of motion in joints that aren't moving properly, and that helps decrease pain and optimize the functioning of the joint and all the muscles and structures that attach to the joint. So the whole system works a lot better together. So some chiropractic myths. So a lot of people think that once they see a chiropractor, they have to keep going back forever, and that's not true. The reason why people stay under chiropractic care for a long time is because they feel so much better after. And I don't necessarily think that it's mandatory for you to come all the time, but if you want to because you feel good, it's a good option. It's better than medication, and I like seeing my patients all the time. Some people also think adjustments are painful. They're not painful. Okay? You've been adjusted before. I've adjusted you. Is it painful?
No.
No.
Feels great.
It feels really good. It's just the loud sound of like cracking your knuckles. You get that sound. That's exactly what it feels like in the spine, and it feels really good. It helps relieve pressure from the joints, and the sound that you hear is just air being released from the joint. Okay? So nothing's breaking or cracking or popping. It's just gas. And adjustments are dangerous, some people think. So as I said, nothing's actually breaking or popping or cracking. It's just gas being released from the joint, so it's very safe and effective, and you feel better. And adjustments are the only treatment that chiropractors use. So this is not true. Some chiropractors like to use the adjustments and then send their patients to massage after or to physiotherapy after to get different types of treatments. And some chiropractors like myself will do the adjustments and acupuncture and soft tissue and exercises. So I take a lot of different tools and I use them with my patients versus just one type of treatment. And a little final note, so using the proper tool for the job can help get the job done faster and easier while placing less stress on the body. So use an ergonomic shovel with a curved handle, a curved shaft, and a D handle. Make sure you use the wider ones for pushing and the smaller ones for throwing. Okay? Thank you. Yay.